y'all, welcome back. My name is Jasmine Jones. I'm a licensed clinical social worker, and you are now tuned into Black Girl, a therapist in the wild. And today we are going to be talking about borderline personality disorder. So stay tuned. So when we discuss borderline personality disorder, it is a personality disorder, tongue-tied, that is located in cluster B. These are the disorders that involve emotional disturbances, extreme emotional fluctuations, extreme behavioral fluctuations, behaviors that do not go along with societal norms and things like that. Borderline personality disorder, I'm going to be looking in my DSM-5 when I describe it is the Diagnostic and Statistical Manual of Mental Disorders that we utilize to help just figure out where people are at mentally when we work with them, when they come to see us. You know, we look at the symptoms, we try to figure out where the symptoms fall in our manual. And it's a guide, I would say. It's a guide. You know, sometimes people can have multiple diagnoses. Sometimes people can have one. Sometimes we just need it for Medi-Cal billing or health insurance billing, and then we kind of tailor make things to make it work out. So the diagnostic criteria, I am tongue-tied. The diagnostic criteria for borderline personality disorder is a pervasive pattern of instability of interpersonal relationships, self-image, and the effects and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. So there's 9 symptoms that mark borderline personality disorders. You only have to have 5 of them in order to qualify for this disorder. Of course, you would want to see a therapist before, don't take this and run with it, okay? But I'm going to just go through each diagnostic criteria and, just kind of explain a little bit what it means, what it looks like, and so on and so forth. So there's 9 of them. You just have to have 5 in order to qualify for this personality disorder. Okay, so the first one is frantic efforts to avoid real or imagined abandonment. So borderline is about, the foundation of it is about feeling abandoned. Like everyone around you will abandon you, or they have abandoned you. So you will do things to keep the person there with you that are extreme and can, cause pain to yourself or to others at times as well. And another thing that can happen is the opposite side of the coin is you can drastically push everybody away as soon as you feel like they are doing something that makes you feel like they will abandon you. Borderlines are very black and white in their thinking. Either it is one extreme, they're going to leave me, or the other extreme, I need to do this to keep them here with me. There's no in between, and that's what makes it so difficult when you're dealing with this disorder. So the second criteria is a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. So that goes into what I was saying before. They go to extremes in their relationships of putting a person on a pedestal. I need to do everything I can to maintain this relationship, to pushing people away as swiftly as possible. This person doesn't want to be with me. I need to get rid of them before they get rid of me. So I'm going to do everything I can in order to do that. And it can be very confusing for somebody that's in a relationship with them because they don't really understand why this person, goes to these extremes of I love you one day to the next day being very cold or distant or volatile or argumentative or doing very petty things or extreme things to push them away. So let's look at the third criteria. Identity disturbance, markedly and persistently unstable self-image or sense of self. So they often have no idea of who they are. They never developed a sense of who they are. Everything about them revolves around the people in their lives a lot of the time. These people define me. If I have somebody in my life, then I am defined. If I'm wanted, I am defined. And that often is what happens, is they look in the mirror and they don't know who they're looking at. They look at their feelings and their hopes and dreams, and either it revolves around somebody else, or you draw a blank, or a myriad of things, but it doesn't feel like you. You don't know who you are. You don't know where you're going. You don't know what you want. And it can be very confusing to live inside the mind of someone who has borderline. So let's look at the fourth criteria. Impulsivity in at least two areas that are potentially self-damaging. So examples are overspending money, sex, substance abuse, reckless driving, binge eating. And a lot of times when we are in pain, people will often seek out extreme coping skills that can turn into addictions and become impulsive behaviors, because we want to drown out the pain. Now, you have to have 5 of these criteria to have borderline, but you can have each one of these different symptoms and different diagnosis. Like, you can have depression and be very impulsive when it comes to sex because you don't want to deal with your depression, but then that doesn't mean you're borderline. It just means that you have one criteria, but you may not go to extremes in your relationships. You may not, have a false sense of self, and the other criteria we're going to get into. So a lot of these will sound like they come from different diagnoses, but you have to have 5 of one of these 9. So remember that, 5 of these 9. So if it sounds familiar, it's okay. Everything, we're all human beings, and we all deal with our pain very differently. And it doesn't mean that we have, anything. Like I said, this is just an informational video. So yeah. Let me see. Number 5, recurrent suicidal behaviors, gestures, or threats are self-mutilating behavior. Now, oftentimes, when people are lost in the feeling abandoned, they will do anything they can to keep the person in their life, from self-harming, threatening suicide. And then sometimes it doesn't even have to do with keeping the person in their life. It could just be that they want everything to end. And, this is a part of the criteria when it comes to borderline. I've had clients like this before who, self-harmed a lot, or would utilize words like, well, if I wasn't here, then, nobody would care, which also sounds familiar for anyone else that might experience suicidal ideation or suicidal thoughts. But with this criteria, those suicidal thoughts specifically circle around abandonment, loss of sense of self, and so on and so forth. So let's see. Number 6, effective instability due to a marked reactivity of mood. Examples: intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours or only rarely more than a few days. So they have unstable moods that can fluctuate up and down. They can experience dysphoria, a type of depression. They can have a lot of anger, anxiety. So the mood just kind of fluctuates up and down. That can last, between a few hours to a day or so, and it just happens, off and on. And they're very sensitive, as we all are. We're all sensitive to some point, but when you're borderline, you're very sensitive to triggers. You read things sometimes the right way, you read things the wrong way, but the way you respond is always in the extreme of things. No matter what, if it's the right conclusion or the wrong conclusion, there's an extreme response of emotion to the trigger. So, number 7, chronic feelings of emptiness. And we all have those moments where we feel empty, or we feel alone, or we feel like nobody cares about us. But this is a pervasive feeling overall. So when you have personality disorders, they differ from mental health in that they're pervasive. They last for most of your life, or a good portion of your life. And when it comes to mental health disorders, they're more periodical. Like something has to trigger your anxiety, and then it might stop for a little while. You might not experience. Well, with borderline, this doesn't stop. This just keeps going. Every day, all the time, especially if you have no treatment for it, if you're not seeing a therapist, if you're not taking medication or anything like that. Number 8, inappropriate, intense anger or difficulty controlling anger. So examples are frequent displays of temper, constant anger, reoccurrent physical fights. So very quick to anger. That goes back to the instability of reactivity to mood, instability of mood, basically. Very quick to anger, very quick to defend oneself from the things that are going on in their mind, from what they perceive may be going on in the world. Like, people are going to leave me, people are going to hurt me, people are going to, make me feel less than, so let me defend myself from them before they do something to harm me. So number 9 is transient stress-related paranoia. Sorry, I read it wrong. Transient stress-related paranoid ideation or severe dissociative symptoms. So disassociating from yourself. Sometimes that is a defense mechanism of the mind where you ever heard that's people talk about sometimes when they're going through extreme trauma, they feel like they're floating above their body and things like that. So you can often feel when you disassociate like you're outside of your body. Some people disassociate and turn into a whole different person. Some people disassociate and black out and, go about their day and don't even realize it. And then they come back, so oftentimes borderline can have those symptoms. So these are the 9 diagnostic criteria for borderline personality disorder. Once again, you have to have 5 in order to be diagnosed with it. So next we're going to talk about some things that have been studied to show, what could cause borderline. When we discuss the causes of borderline, just understand that no one's exactly 100% sure. There have been studies on some of the things that can, be a precursor to borderline personality disorder. But like I said, no one can pinpoint an exact thing that causes it. So these are just some studies that I've looked up and researched to bring to you guys. So one of the things that could be a precursor and a big decider for borderline personality disorder is trauma. Studies have found that a lot of people with borderline personalities, I keep saying personalities and borderlines. I don't know what's wrong with me. Sorry, it's not funny. It's just funny because my speech is just, So anyways, it could be prolonged sexual trauma. We talked about CPTSD in one of my previous videos. Borderline personality disorder and CPTSD symptoms do look alike. However, not often, but you don't have to have trauma in order to have borderline. With CPTSD, you do have to have trauma, in your past to have that. So it could be CPTSD, chronic post-traumatic stress disorder. So basically the trauma that you experience was repeated over time, again and again, basically a torture situation, childhood abuse situation, relationship abuse where you were in a relationship for a long time, war camps, things like that. Even being bullied can show that there's enough trauma to be a precursor to borderline personality disorder. So yeah, there was a recent study done in Scandinavia it just came out on October 2019, and 71% of the borderline personality patients in that study reported to have some history of trauma. So there are a lot of studies saying that a lot of people with borderline personality have trauma in their past. Some don't, but it's starting to look more and more like the some that don't are outliers. They're the odd ones out compared to the ones that have had trauma. And odd ones out doesn't mean like there's something wrong with them or anything like that. It more so just means like when we're pinpointing a reason why this happens, a reason why this develops, it's looking more and more like trauma has a lot to do with it. It might not be the root cause, the only cause, but it looks like it has a lot to do with it. So that's an interesting thing to think about. So another thing that could be a precursor to borderline personality disorder is genetics. Twin studies have shown that 42 to 69% of twins have developed borderline personality disorder. So yeah, and studies have shown that first generational relatives, if your first generational relative has had personality disorder, then you're more likely to have it. And that's like your parents or your sibling. So the next generation over, like the people you came from, basically, not your third cousin, but like one generation back or one generation to the side with a sibling came from the same parents or something like that, then you have a susceptibility to having borderline personality disorder. So there is a genetic root to it as well, with twin studies showing that if one twin has it, another twin could have it. And with first generational studies as well. With the studies of the first generational folks that are more likely to pass down through genes borderline personality disorder, BPD, I'm just going to say that. BPD, they also live in the house with these people. So, sometimes cause can get a little shaky there when it comes to genetics, because you're growing up in a house with somebody that has borderline personality disorder, and then they're first generational, so genetically they may be passing it down, but what came first in that situation, the chicken or the egg? So I'm going to be reading a little bit of my notes that I wrote for this one because I want to make sure I get it right. When it comes to your brain structure, that has shown that people with borderline personality disorder can have a different brain structure. Your amygdala, your prefrontal cortex, the hippocampus, the hypothalamus, the limbic system, they're all different. The structures are different in folks with borderline personality disorder. So the direct areas of your brain that run your emotion regulation, your impulsivity, and your aggressive behavior is a totally different structure than somebody else that doesn't have borderline personality disorder. So brain structure can be a part of this too. So now I want to talk about treatments that work for people with borderline personality disorder. So, dialectical behavioral therapy is very good in helping clients get back in touch with their emotions, get back in touch with building a sense of self. And if you can find a therapist that specializes in it, it can be very helpful for you. Other modalities, TFCBT, that's trauma-focused therapy, EMDR, eye movement, and desensitization. See, I don't do EMDR, I do DBT. Eye movement, desensitization, and reprocessing. That is a form of trauma therapy. So that is something else that you can consider when deciding to choose a therapist to help. Especially if you have trauma in your past. it's probably good to kind of steer towards a trauma therapist. DBT works with trauma as well. Just a trauma therapist that work through your history, work through what happened. And if you didn't have trauma in your past and you just kind of have this and you don't necessarily know why, you know, a good therapist can get you started on the right track on figuring it out. Psychodynamic therapy can help as well. Talking about your past and working through it. And also understand that neuroplasticity is a thing. Neuroplasticity is basically your brain can restructure itself as long as you follow your treatments, therapy, take your medication regularly. Studies have found that people that have BPD, that follow their treatments, take their medication regularly, do the things that they're supposed to do, after about 10 years of constant, consistent work on themselves, studies have found that people have shown to not have BPD anymore. It can go away. It is curable as long as you stick to your treatment, your regimen, and the positive coping skills that you've learned through therapy. So when you consider that, it's like, okay, in our field of therapy, a lot of therapists are afraid of the diagnosis of BPD because they say the clients can get, because their emotions are so, they fluctuate so much and they can get so attached to folks, and because they feel so down on themselves and feel like everyone's going to leave them. It's like almost starting over every session sometimes because, you don't necessarily know what you're going to do as a therapist to kind of make this person feel like you're not there to help them. So it takes a lot of patience and a lot of work to work with borderline personality disorder patients, but you shouldn't be afraid of them. They're just regular people. They just want to know how to be loved and how to love themselves. Most importantly, how to love themselves, And if you do the work, I work with borderline patients, and when you do the work and you stick to it and you're patient and you set firm boundaries, you can get really good healing done. So from a therapist to clients, don't be afraid to seek help. Find a therapist that works for you. Find a therapist that understands what you're going through. Find a therapist that is patient and considerate and consistently shows you that they are willing to take the time to help you. And it's okay. The diagnosis does not define you because it's curable. After 10 years, it's gone. And even if it wasn't curable, it still doesn't define you. It's just something that you have, but it's not something who you are. I always try to be philosophical and it gets all kerschmubbled. But it's not who you are, basically. It's something that you have, but it's not who you are. It's like, I have pimples, but I'm not pimples, I can make them go away eventually, hopefully, but even if I can't, I'm not that pimple on my face. So you are not borderline. You have borderline, but you are not borderline. And if any of this sounds familiar to you, if any of the things, of the criteria, of the symptoms that I mentioned earlier sound familiar to you, if more than 2 of the symptoms sound familiar to you, I would go seek out therapy. If you haven't already, go seek out, somebody that will work with you and help you to understand what are these things that are ticking off some lights in my head? What are these criteria and these symptoms that I'm hearing that are making me think right now? It might not be borderline because borderline is a pretty extreme mental health disorder. But it could be something else. Or it might just be that you need somebody to talk to. Go to therapy. Everybody just go to therapy. That's what I want to say. Everybody needs a therapist. I needed a therapist at one point. Most of my coworkers that I work with needed a therapist at one point. Your therapist goes to therapy. You go to therapy. Everybody goes to therapy. And you can have church and family and school and friends surrounding your therapy, because your therapist is going to tell you to reach out to people that support you. Your therapist is going to tell you to go to church if church helps you, you know. And if they don't tell you to reach out to people that support you, and if they don't tell you to go to church, then they're probably not the greatest therapist for you. And I mean, go to church if you go to church and that's the thing that is supportive to you. That was just an example, because some people aren't religious. So if they don't tell you to go to church because you're not religious, then that's something else. Okay. But yeah, so I figured I'd get back to the mental health stuff because I've been having a little bit too much fun, and I want to make sure that you guys know that this is an educational channel too, to learn about different diagnostic criteria, different mental health disorders, and, you know, just to let folks know that you're not alone out there. There are a lot of people with a lot of different things going on, and we're all just out here trying to seek help. So yeah, that is it. I hope this was informative, and yeah. Later days.